Bonjour and welcome back to the portion of today's media update on the vaccine rollout and logistics. Bonjour et bienvenue à cette partie de la mise à jour de presse sur le déploiement et la
Moderna vaccine for use in Canada. So let's get the latest details on the vaccine rollout from federal officials now.
Major-General Dany Fortin from the Public Health Agency of Canada, followed by Dr. Tom Wong from Indigenous Services Canada. They will be accompanied by Dr. Supriya Sharma and Dr. Marc Berthiaume from Health Canada, as well as Ms. Arianne Reza from Public Services Procurement Canada. Aujourd'hui, nous entendrons parler des allocutions du Dr. Howard Njoo et du Major-Général Dany Fortin de l'Agence de la santé publique du Canada, ainsi que Dr. Wong de Services aux Autochtones Canada. Ils seront accompagnés par Dr. Supriya Sharma et Marc Berthiaume de Santé Canada, ainsi que de Mme Arianne Reza de Services publics et Approvisionnement Canada. Ensuite, nous prendrons vos questions jusqu'à 15h15. Donc, nous commençons maintenant. Over to you, Dr. Njoo.
Thank you very much. Merci. Hello, everyone. Thank you for joining us for this technical briefing on the COVID-19 vaccine rollout in Canada. With me to deliver remarks and answer questions are Major General Dany Fortin, Vice President of Logistics and Operations at the Public Health Agency of Canada, and Dr. Tom Wong, Executive Director and Chief Medical Officer of Public Health at Indigenous Services Canada. To assist in answering your questions, we have with us from Health Canada, Dr. Supriya Sharma, Chief Medical Advisor, and Dr. Marc Berthiaume, Director of Medical Science. And on the line, we have from Public Services and Procurement Canada, Arianne Reza, the Assistant Deputy Minister of Procurement. Today, Health Canada announced the authorization of another vaccine from Moderna. We will share more details about the rollout of the Moderna vaccine today, as well as planning and logistical details. When we were last here on December 16th, news and images of the first Canadians receiving the Pfizer-BioNTech vaccine were just beginning to trickle in. Now, I can report that by the end of today, there will be more than 240,000 doses of the vaccine that will have been distributed across all provinces. We will continue to follow the evidence-based recommendations of the National Advisory Committee on Immunization on the need for early vaccination to priority groups, including frontline healthcare workers, residents and workers in long-term care facilities, as well as Indigenous peoples who are at risk of being disproportionately impacted by COVID-19. In addition to NACI's recommendations, allocation and delivery of both authorized vaccines will be informed by vaccine availability and suitability, the overarching principle of equitable allocation and logistical considerations. Having negotiated agreements with 7 vaccine manufacturers, Pfizer-BioNTech and Moderna among them, we are well positioned to provide access to COVID-19 vaccines to everyone living in Canada by September 2021. Our negotiations have also allowed Canada to secure advanced doses of the Pfizer-BioNTech and Moderna vaccines, enabling tens of thousands of Canadians to be vaccinated this month. The Public Health Agency of Canada is delivering a series of webinars to prepare healthcare providers for the rollout of the first COVID-19 vaccines. We want to ensure they have the answers to their patients' questions about the vaccines. As trusted sources of information, they are well positioned to reinforce that Canadians can trust safety and effectiveness of the vaccines based on the rigorous Health Canada authorization process. While vaccination gets underway, Canadians play a critical role right now in order to continue following the public health measures and the COVID-19 guidance of the regional public health authorities. We know Canadians are committed to protecting themselves, their families, and their communities. Bonjour à tous et à toutes. Merci de vous joindre à cette séance d'information technique sur le déploiement de vaccins contre le COVID-19 au Canada. Je suis accompagné du Major-Général Dany Fortin, vice-président de la logistique et des opérations à l'Agence de la santé publique du Canada, et de Dr. Tom Wong, directeur exécutif et médecin hygiéniste en chef de la santé publique à Services aux Autochtones Canada. J'ai également à mes côtés la Dr. Supriya Sharma, conseillère médicale principale, et le Dr. Marc Berthiaume, directeur du Bureau des sciences médicales, tous deux de Santé Canada. Et Mme Arianne Reza, sous-ministre adjointe de la Direction générale des approvisionnements à Services publics et Approvisionnement Canada. Aujourd'hui, Santé Canada a annoncé l'autorisation d'un autre vaccin, celui du fabricant Moderna. Nous allons vous donner plus de détails sur le déploiement de ce vaccin aujourd'hui, ainsi que sur la planification et la logistique. La dernière fois que nous nous sommes vus ici, le 16 décembre, des nouvelles sur les premiers Canadiens à recevoir le vaccin de Pfizer-BioNTech ainsi que des images commençaient à être diffusées. Je peux maintenant vous dire que d'ici la fin de la journée, plus de 240 000 doses de vaccins auront été distribuées dans toutes les provinces. Nous continuerons de suivre les recommandations fondées sur les données probantes du Conseil consultatif national de l'immunisation, le CCNI, qui sont de vacciner d'abord les groupes prioritaires, dont les travailleurs de santé de première ligne, les membres du personnel des établissements de soins de longue durée, ainsi que leurs résidents âgés et les personnes vivant dans les collectivités autochtones, lesquelles sont susceptibles d'être touchées de manière disproportionnée par la COVID-19. En plus de suivre les recommandations de CCNI, les décisions portant sur la distribution et la livraison des 2 vaccins autorisés seront fondées sur l'accessibilité et l'adéquation des vaccins et sur le principe fondamental de la distribution équitable ainsi qu'en fonction de considérations relatives à la logistique. Comme nous avons négocié des ententes avec 7 fabricants de vaccins, dont Pfizer-BioNTech et Moderna, nous sommes bien placés pour assurer l'accès aux vaccins contre le COVID-19 à l'ensemble des Canadiens d'ici septembre 2021. Nos négociations ont également permis d'obtenir les premières doses de vaccins de Pfizer-BioNTech et de Moderna, ce qui permettra à des dizaines de milliers de Canadiens de se faire vacciner ce mois-ci. L'Agence de la santé publique du Canada offre des webinaires pour préparer les fournisseurs de soins de la santé au déploiement des premiers vaccins contre la COVID-19. Nous voulons nous assurer qu'ils ont les réponses aux questions de leurs patients au sujet des vaccins. Comme ils sont des sources d'informations fiables, ils sont en mesure de renforcer le message adressé aux Canadiens qu'ils peuvent faire confiance aux vaccins que Santé Canada a rigoureusement évalués avant d'autoriser. Les normes rigoureuses de Santé Canada garantissent l'innocuité et l'efficacité des vaccins. Alors que la vaccination commence, les Canadiens assument le rôle le plus important en ce moment, soit celui de respecter les mesures de santé publique et de suivre les consignes relatives à la COVID-19 des autorités de santé publique de leur région. Nous savons que les Canadiens veulent se protéger leurs familles et leurs collectivités. J'invite maintenant le Major-Général Fortin à prendre la parole et par la suite, ce serait au tour de Dr. Tom Wong de dire quelques mots. Major-Général Fortin, je vous cède la parole.
Thank you very much, Dr. Njoo. The authorization of the Moderna vaccine is a big milestone for Canada today. Moderna will be the first COVID-19 vaccine to be delivered to Canada's remote and isolated communities and to Canada's north. Last week, we completed a dry run to confirm the ordering, importation, and the shipping processes for the Moderna vaccine, and to fine-tune temperature monitoring of the shipments in transit. In concert with our logistics service provider, FedEx and Omar, we are ready to deliver up to 168,700 doses of the Moderna vaccine next week. The second round of shipments from our December allocation of Pfizer-BioNTech vaccine is arriving this week. That second round will have an additional 212 doses, with more coming next week to complete the December allocation, as previously mentioned. We expect 125,000 doses in the week of January the 4th, and the number is expected to increase to 200,000 per week for the rest of January. In the coming weeks, we'll see an increase from the original 14 sites to more than 100 vaccine delivery sites across Canada next week, with more coming online in the new year. The Public Health Agency of Canada continues to acquire and deliver equipment such as ultra-low temperature freezers, dry ice handling kits, -20 freezers, Credo cubes, etc., to enhance cold chain capacity across the country. We're building capacity and collaborating with our federal, provincial, territorial, and Indigenous partners to ensure that as many Canadians as possible can be safely immunized against COVID-19 and as quickly as possible. We're also working closely with national security partners and law enforcement. Together, we're paying close attention and monitoring the full spectrum of potential security issues. This is an unprecedented nationwide effort. Every link of the chain matters. Every person matters. I would like to thank the many dedicated and talented professionals from across all agencies and organizations who are doing the utmost to get COVID-19 vaccines to Canadians who need them. L'autorisation du vaccin de Moderna est une étape charnière pour les Canadiens. Moderna sera le premier vaccin contre la COVID-19 à être administré dans les collectivités éloignées et isolées du Canada, ainsi que dans le nord canadien. La semaine dernière, nous avons effectué un exercice de distribution pour confirmer les processus de commande, d'importation et d'expédition du vaccin de Moderna et pour ajuster la surveillance de la température des envois en transit. De concert avec nos fournisseurs de services logistiques, FedEx et Innomar, nous sommes prêts à livrer plus de 168 700 doses initiales du vaccin de Moderna contre la COVID-19 au cours de la prochaine semaine. La deuxième série d'envois de notre attribution de décembre pour le vaccin de Pfizer-BioNTech arrive cette semaine. Cette deuxième série d'envois représente 212 000 doses additionnelles, avec d'autres qui suivront la semaine prochaine pour compléter l'attribution de décembre, tel que mentionné il y a quelques minutes. À compter de la semaine du 4 janvier, nous planifions recevoir 125 000 doses du vaccin de Pfizer et à compter de la semaine suivante, à chaque semaine, un envoi de 200 000 doses pour le reste de janvier. Au cours des prochaines semaines, nous assisterons à une augmentation du nombre de points de service de vaccination qui passera du 14 initial à plus de 100 au cours de la semaine prochaine et d'autres s'ajouteront au cours du mois de janvier et ainsi de suite. L'Agence de la santé publique du Canada continue d'acquérir et de livrer de l'équipement comme des congélateurs à très basse température, des trousses de manutention pour la glace sèche, des congélateurs à moins 20 degrés, et tout ça pour améliorer la capacité de préserver la chaîne de froid partout au pays. Nous continuons de renforcer les capacités et de collaborer avec nos partenaires fédéraux, provinciaux, territoriaux et autochtones pour faire en sorte que le plus grand nombre de Canadiens puissent être vaccinés en toute sécurité contre la COVID le plus rapidement possible. Nous travaillons également en étroite collaboration avec nos partenaires de la sécurité publique et des forces de l'ordre. Ensemble, nous prêtons une attention particulière et surveillons les aspects de sécurité reliés à la vaccination, à la distribution des vaccins. Alors, il s'agit d'un effort national sans précédent, comme mentionné par le passé. Chaque maillon de la chaîne compte, chaque personne compte. Je tiens à souligner le travail de tous les professionnels dévoués et talentueux de l'ensemble des agences et organismes à tous les niveaux qui travaillent sans relâche pour offrir le vaccin à tous les Canadiens le plus rapidement possible. Et sur ce, je vous remercie. Je passe la parole à mon collègue, Dr. Wong.
Oui, merci. I want to acknowledge that we are on the unceded territory of the Algonquin people. As of December the 22nd, 7,615 First Nation on reserve active COVID cases have been reported. This compares to over 520,000 active cases reported in the general Canadian population. Sadly, there have been 69 on-reserve fatalities, comparing to over 14,000 reported deaths in the overall Canadian population. Although efforts continue across communities, regions, and jurisdictions to limit the transmission, I remain concerned with the ongoing spread of COVID-19 in communities. We must redouble our efforts to protect Indigenous communities, First Nations, Inuit, and Métis, particularly elders from COVID-19. First Nations, Inuit, and Métis have worked diligently to control the spread of the virus in their communities. We acknowledge their strength and resilience and the hard work they continue to put into leading their communities to safety. it is imperative that First Nations, Inuit, and Métis be partners with provinces and territories in the co-planning for the culturally safe and equitable vaccine access in both rural and urban areas. We are engaging Indigenous partners directly through the COVID-19 Vaccine Planning Working Group, where federal, provincial, territorial, and Indigenous partners have been exploring vaccine rollout in every province and territory for all First Nations, Inuit, and Métis people, regardless of where they live. We are taking deliberate steps to ensure the safe, efficient, and equitable distribution of the COVID-19 vaccines across Canada, especially into the territories, Indigenous, isolated, and remote communities, and impoverished urban Indigenous settings. We will continue to facilitate the collaboration needed to address barriers to access and to support First Nations, Inuit, and Métis to make informed decisions. We are in this together. Nakumik, miigwech, merci, merci, and thank you. Je tiens à souligner que nous nous trouvons sur le territoire ancestral non cédé du peuple algonquin. En date du 22 décembre, on a enregistré 7615 cas actifs de COVID-19 dans les réserves des Premières Nations. En comparaison, plus de 520 000 cas actifs de COVID-19 étaient déclarés dans l'ensemble de la population canadienne. Malheureusement, on a enregistré 69 décès dans les réserves. Comparativement, plus de 14 000 décès déclarés dans l'ensemble de la population du Canada. Bien que les efforts se poursuivent dans les communautés, les régions et les juridictions afin de limiter la transmission, je reste concerné avec la propagation actuelle de ce virus. Nous devons redoubler nos efforts pour protéger les communautés autochtones, en particulier les aînés de la COVID-19. Les Premières Nations, les Inuits et les Métis ont travaillé avec diligence pour limiter la propagation du virus dans leur communauté. Nous saluons leur force et leur résilience et leur dur travail qu'ils continuent de faire pour que leur communauté soit en sécurité. Il est impératif que les Premières Nations, les Inuits et les Métis fassent équipe avec les provinces et les territoires pour planifier conjointement un accès du vaccin qui soit juste et adapté à la culture, tant en milieu rural qu'en milieu urbain. Nous faisons participer les partenaires autochtones directement par l'entremise du groupe de travail sur la planification de la vaccination contre la COVID-19, au sein duquel les partenaires des gouvernements fédéraux, provinciaux et territoriaux et les partenaires autochtones peuvent discuter du déploiement du vaccin dans chaque province et territoire pour l'ensemble des Premières Nations, des Inuits et des Métis, peu importe l'endroit où ils vivent. Nous prenons des mesures mûrement réfléchies pour assurer une distribution sécurité, efficace et équitable des vaccins contre le virus COVID-19 partout au Canada, en particulier dans les territoires, dans les communautés autochtones isolées et éloignées et auprès des Autochtones en situation de pauvreté en milieu urbain. Nous continuerons à faciliter la collaboration pour briser les barrières afin d'accepter et de supporter les Premières Nations, les Inuits et les Métis afin qu'ils puissent prendre des décisions informées. Nous sommes tous ensemble. Nakumik, Miigwech, merci, thank you et merci.
Merci beaucoup, Dr. Wong. We will now open the telephone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking questions in the room, we ask that you make your way over to the freestanding mic. We will start on the phone for two questions before turning to the room. Operator, over to you.
Thank you. Merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Boris Prou, Le Devoir. À vous la parole.
Bonjour, ma question s'adresse au Major-Général Fortin. J'aimerais savoir, dans les documents qu'on nous présente, on dit que la première commande est concentrée sur les régions du Nord et les communautés éloignées. J'aimerais avoir plus de détails là-dessus. Est-ce qu'on sait où exactement vont la première commande? Ce sera constitué de combien de doses, etc.?
Oui, alors, la première commande, effectivement, de 168 000 quelques doses, la commande est en voie d'être envoyée. On s'attend à ce que ça arrive et que ce soit en voie d'être distribué dès lundi le 28 dans les provinces et dans les territoires. Les endroits exacts, écoutez, c'est au-delà d'une centaine de points de livraison à tous les niveaux. Nécessairement, il y a quelques points seulement au sein des territoires, mais les 3 territoires reçoivent dès lundi leur dose. Alors, à ce moment-ci, on préfère laisser aux provinces et territoires l'opportunité de divulguer les endroits lorsqu'ils seront prêts à divulguer. Mais vous pouvez comprendre qu'on va continuer de croître ce nombre de sites au cours des prochaines semaines et mois, selon la capacité des provinces et territoires et selon la quantité qui nous est rendue disponible dans le temps.
Merci beaucoup. Question suivie?
Merci. Question suivie s'adresse au Dr Njoo. J'aimerais savoir, est-ce que l'annonce d'aujourd'hui change quoi que ce soit dans le fameux portrait que vous nous avez présenté il y a quelques semaines concernant les étapes de vaccination de la population? Là, je ne les ai pas en tête, mais c'était que le grand public pourrait être vacciné à partir du mois d'avril et que la vaccination serait terminée pour décembre 2021.
Merci pour la question. Je pense que c'est vraiment des bonnes nouvelles aujourd'hui avec l'approbation du vaccin de Moderna, mais comme j'avais déjà constaté, on a déjà avant même planifié en attendant que le vaccin Moderna soit approuvé. On a planifié pour 4 millions de doses de Pfizer et 2 millions de doses de Moderna pour le premier trimestre de 2021. Je pense que maintenant, on a beaucoup plus de flexibilité, il y a beaucoup plus des options aussi pour les provinces et territoires pour vacciner leur propre population. Comme Major-Général Fortin a aussi précisé, c'est très important pour les territoires, aussi les communautés éloignées, isolées, parce que c'est beaucoup plus facile, si on parle de la logistique, pour livrer et distribuer les vaccins de Moderna au nord. Et c'est sûr que ça va être une bonne nouvelle pour les territoires quand ils vont recevoir leur vaccin, j'espère bientôt, dans les prochaines semaines. Et puis après, avec les doses qui viennent de continuer d'être livrées ici au Canada, on attend, après le premier trimestre, c'est sûr, on a les populations prioritaires au début, qu'on peut offrir le vaccin à beaucoup plus de Canadiens. Je pense au début du mois d'avril, aussi pour le reste de l'année. Et je pense qu'on est sur le bon chemin pour offrir le vaccin à tous les Canadiens d'ici le mois de septembre 2021. Merci.
Merci, Dr. Njoo. Opérateur, prochaine question.
Thank you. Merci. The next question is from Marika Walsh, The Globe and Mail. Please go ahead. Your line is open.
Hi there. Thank you so much for taking our questions this afternoon. I'm wondering if Major General Fortin can give us a bit more insight into the reliability of the vaccine delivery that you just rolled out. Is there any reason to believe that the promised doses from Moderna or Pfizer won't show up on time?
Well, we have no reason to doubt on the distribution of Pfizer product. It's been progressing very well to date. We had 74 different sites this week, a few more added in next week, and no indications of any mishaps anywhere. So we're very happy about how this is being rolled out. In terms of Moderna, as I said earlier, we executed a dry run that was helpful in ensuring that we have a good understanding of the different steps and different activities, and it builds confidence with all partners and provincial and territorial authorities that see this demonstration. So now they can make the necessary adjustments. They've turned on their different sites and they're ready to receive, starting next week, the Moderna product.
Thank you.
Okay, thank you so much. And Dr. Njoo, I'm wondering if, given what Major General Fortin is saying, what you think of provinces that are deciding to hold back some of the vaccine that they're receiving for that second doses. Is that a good idea or a bad idea, given how high the need is right now to get these shots in people's arms, especially in long-term care homes and hospitals?
Thank you very much for the question. Certainly, that's been a topic of active discussion among the Chief Medical Officers of Health, along with ourselves here at the Public Health Agency of Canada at the Special Advisory Committee. Certainly, I think it's good news in terms of getting more precision, I would say, in terms of the doses that would be coming to Canada over the coming weeks and months. And according, obviously, to the manufacturer, I don't see any issue. I think it's less of an issue now in terms of having the doses available to do what we call the two-dose regime for workers. So I think that the province and territories, I think, are looking at some of the operational details in terms of how they actually roll out the vaccination. But certainly, my understanding is that everyone's prepared to have the doses ready and available so that they can offer the two-dose regime to all of the people that are being vaccinated. Thank you.
But the question is, do you
It's one question.
recommend that all of it be sent out?
Sorry, I missed that. Yeah. Well, the thing is, it's obviously with the delivery of the vaccine sort of as a rolling schedule or sort of the regular schedule. The issue of, I'm not sure, holding back and so on. I think that as provinces roll out, certainly there is obviously the sort of the actual operationalization of administering the doses to the frontline workers and people who are in the priority populations. I don't think it's really a question of holding back. I think all the doses that are being received by the provinces and territories are being used to good effect in terms of being administered. And whether an actual tray sits in a refrigerator for a week or so, I would say that at the end of the day, it's being rolled out the way it could or should be. Thank you.
Thank you, Doctor. And I'd like to remind it's one question, one follow-up only, please. We'll turn to the room. First question, CTV.
Rachel Haynes here from CTV National News. My first question is for Major General Fortin. Just to clarify a little bit more about the Pfizer rollout in January, you went a little quickly over the numbers there. So if you could go back to that, you mentioned it was 125,000 in the first week of January and then 100,000 additional each week. What is the total that we're looking at for Pfizer at the end of the month, and also the Moderna schedule in January? What are we looking at each week for Moderna vaccines?
Yeah, thank you. As the Prime Minister announced earlier today, 750,000 doses in January is what we're looking at. So 125,000 the week of January 4, and then it's a couple of hundred a week in the following weeks. It's important to remember this is a deliberate operation. We're going to grow the number of sites as we get more stability data and we're able to further distribute down from those sites to additional sites. There'll be a better spread. But it's a deliberate, progressive. We progressively add a number of sites. In terms of Moderna, so this is the first shipment for next week. We expect to have a similar quantity in the mid-January timeframe, but this is still being coordinated right now. So we have a number of planning assumptions for that and moving forward in terms of both Moderna and Pfizer products. And we're working actively to confirm those planning assumptions, turn them into facts as we move forward.
Thank you. Follow-up?
And looking to the end of the quarter, provinces had been initially told that it would be about 4 million Pfizer vaccines and 2 million Moderna vaccine doses. Is that still the schedule that we're looking at? Are you confident that Canada is going to reach that amount by the end of the quarter?
That is our assumption, 4 million and 2 million in the first quarter. And I'm working with that plan.
Thank you. Prochaine question?
Micheline Laflamme de Radio-Canada. J'aimerais peut-être avoir un peu dans vos mots l'impact justement de l'autorisation de Moderna sur la campagne de vaccination au Canada.
J'assume que vous voulez que je commence.
Dr. Njoo, peu importe.
Laissez le Dr. Njoo commencer.
Je pense que j'ai déjà répondu à la question, mais je peux répéter qu'avec l'approbation du vaccin Moderna, c'est des bonnes nouvelles parce que maintenant, on a 2 vaccins approuvés au Canada. Ça nous donne, je pense, beaucoup plus de flexibilité et des options. L'avantage du vaccin Moderna, c'est que c'est plus facile à manipuler aussi, si on parle de la logistique, pour les communautés éloignées, isolées au nord. C'est sur les territoires. Dans notre planification, ils ont demandé de recevoir seulement le vaccin Moderna. Pour eux, c'est seulement Moderna. Et avec l'approbation, maintenant, Major-General Dany Fortin peut préciser. C'est ça, on va continuer avec le travail avec les territoires pour livrer le vaccin Moderna au territoire. Donc, je pense qu'on peut offrir maintenant plus de Canadiens. Et après aussi, avec les doses, je pense que le premier ministre a annoncé, c'est sûr, au fur et à mesure, on va offrir de plus en plus à des Canadiens. Et avec le deuxième trimestre, on attend d'être capable d'offrir le vaccin à beaucoup des Canadiens. Et je pense qu'on est sur le bon chemin pour être capable d'offrir le vaccin à tous les Canadiens d'ici le mois de septembre 2021.
J'ajouterais simplement, c'est une excellente nouvelle. Pour nous, c'est maintenant le temps de concentrer nos efforts sur la coordination étroite de livraison dans les endroits moins accessibles au Canada. L'hiver, population répartie comme on le connaît, avec tous les défis que ça peut poser. C'est une excellente nouvelle pour tout le monde. C'est une excellente nouvelle pour les gens en régions éloignées, puis certainement au sein des territoires. Alors, notre focus présentement, c'est vraiment faire ça le plus efficacement possible, le plus rapidement possible. Et tout le monde est orienté là-dessus, incluant nos fournisseurs de services logistiques. Alors, on est très énergisé par cette nouvelle et puis on va voir la distribution la semaine prochaine.
Merci. Question suivie?
Et je me demandais aussi où en sont les négociations avec les provinces pour la distribution du vaccin dans les communautés éloignées. Je parle provincial, pas les territoires, mais vraiment avec les provinces, avec les communautés autochtones. Est-ce qu'on a une idée du début de la vaccination dans les communautés autochtones? Est-ce que les Forces armées canadiennes vont peut-être devoir participer à cet effort-là?
Je pourrais peut-être dire quelques mots, puis demander à mon collègue de couvrir le reste, mais je vous dirais qu'on est en coordination serrée tous les jours, tous les niveaux. Nous, avec le Centre national d'opération de vaccins, mais également nos partenaires et puis Services aux Autochtones qui sont en coordination étroite. Tout le monde, ça parle. Les provinces reçoivent des doses pour distribuer dans ces régions plus éloignées. Ils sont en train de regarder, bien entendu, leurs ressources humaines spécialisées pour faire ça. Et puis mettre les efforts en vue de distribution au cours des prochaines semaines à mesure que les quantités vont se présenter. Bien entendu, c'est des petites quantités au début, 168 000 maintenant, quelque chose d'à peu près équivalent, on pense, pour le mi-janvier. Alors, on travaille à accélérer autant que possible cette visibilité sur ce qu'on va avoir pour pouvoir être bien positionné dans le nord des provinces et puis les communautés éloignées.
Oui, merci de votre question. Alors, il est impératif que les Premières Nations et les Inuits et les Métis fassent équipe avec les provinces et les territoires à la même table pour co-planifier l'approche de vacciner les gens du Nord. Il est très important que nous travaillons ensemble. Oui.
Seulement, je peux ajouter quelques mots à ce que le Dr. Wong a constaté, que oui, on est en train d'avoir, comme dit, des rencontres, réunions comme vraiment trilatérales avec le gouvernement fédéral, aussi des provinces, et aussi avec les leaders, le leadership des Autochtones. So, c'est vraiment à l'échelle vraiment régionale et locale. C'est vraiment, on rentre dans les détails opérationnels maintenant.
Parfait, merci à vous trois. We'll now turn over to the phone for the remainder of the question period. I would like to do one question on the phone, one question in the room. So let's go to the phone. Over to you, operator.
Thank you. Merci. The next question is from Ryan Tumulty from National Post. Please go ahead.
Yeah, hi there. I'm wondering, in your discussions with the provinces, if you have a sense of how much vaccine they can absorb as it becomes available, and are you keeping a track on that in terms of deliveries so that we don't have any vaccine sitting and waiting?
So we very much keep track on quantities distributed at the various sites, and we're in coordination, as I said before, with provinces and territories, with the right authorities. More importantly, we ensure that at all levels we have the right level of readiness, that we have the right equipment, that we are ready to take on additional shipments. So there's more capacity than there is product, for sure, in terms of ability to store at the different sites. There's more capacity than there's product available at this time. So this is not a concern of mine right now. But we continue to ensure that we have the right equipment to store and proceed with vaccination with the provinces and territories. So we keep a watchful eye on what else they might need when this equipment becomes available, ancillary equipment, freezers, PPE, and all that stuff. So that's being pushed to provinces and territories, and will continue into the new year so that we're comfortable with what we have. But every possible site at this stage has the equipment to store the vaccine, whether it's freezers, countertop freezers, or the thermal shipper themselves, which allows you to store the vaccine for a period of time, depending on the product. So that's in good hand right now.
Yeah, it's Dr. Njoo. Maybe just add a couple of additional words. I think that certainly with the approval of the Moderna vaccine today, I think it's excellent news because if you look at the characteristics, the profile of this vaccine, it's much easier to handle. In terms of even, quote, the shelf life, compared to the Pfizer product, which, obviously the ultra cold chain logistics, and then even once you open up a vial, you have to use it very quickly. The Moderna vaccine certainly has a lot more sort of a flexibility in terms of how it could be used, administered. And with that in mind, I think it will be much easier to plan with our provincial territorial counterparts in terms of how it's rolled out. And certainly we don't anticipate that the vaccine, as you put it, will be sort of sitting around. I'm not sure if Dr. Sharma and others have maybe any additional words to add. No.
Thank you very much. Follow up?
Yeah, so based on the numbers you provided, 1.2 million doses overall would have been delivered by the end of January. Does that mean, considering we're supposed to have 6 million doses by the end of March, you expect a big ramp up in February and March?
Well, I said before, deliberate, progressive. So that's very much what we have in mind. And there's a global demand for vaccines. So the manufacturers are providing in the quantities that have been announced and will produce at scale. And those numbers will increase in the following months. So I anticipate a significant growth in quantities available in February, March. I would be speculating as to what exactly that looks like, but as I indicated before, we have daily conversations with the manufacturers, and we'll increase this frequency now with Moderna as well. So we'll have in the coming weeks more clarity as to what that looks like in February onwards.
Thank you very much. And we'll now turn to the room. Next question, Global News.
Hi, Chris Lowe with Global News. Major General Fortin, my question's for you. I was hoping you could provide a bit more clarity on the timeline of the rollout next week. So you did mention next week, but can you perhaps tell us when and where the very first Moderna vaccine will be given to a Canadian in this country?
We're on track for delivery December 28th in the territories, as well as in the provinces. But certainly we're on track for December 28th, pending any, or unless there are any issue weather-wise, everything's on track for that.
So December 28th is when the first Canadian will get the vaccine?
December 28th, we can expect to have vaccines arrive in territories, the first vaccines.
And sorry, as a follow-up, you mentioned a lot about the northern communities and isolated and rural areas, but is there any talk of long-term care residents in this terms of the first Moderna vaccine rollout? And if you could provide more details on that.
Yeah, in discussions with our partners, that they follow the NACI guidelines, including in the territories. They intend to administer those populations that are identified as priority groups. So as to the detail, perhaps Dr. Njoo would have more.
Yeah, one thing I would add is in terms of the Moderna vaccine and the delivery to the territories, if you look at sort of the NACI recommendations and the 4 priority groups, I think certainly for the provinces, with sort of a more limited supply of the vaccine in the first quarter, that they would focus on that. But with the unique situation in the north, the isolated communities, lack of access to, let's say, tertiary healthcare facilities and so on, the planning assumption has been to really deliver enough vaccine to be able to cover 75% of their population, so that we're not making multiple trips to a small community. Say, well, okay, how many seniors do you have, or how many people in a certain type of a situation? I think it's really, in a sense, get it all up there, and then they can start vaccinating their populations as a whole.
Thank you. We'll now turn back to the phone. Operator.
Thank you. Once again, please press star 1 if you have questions. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. There are no further questions registered at this time. Nous n'avons plus de questions pour le moment.
Thank you. We'll turn back to the room. Canadian Press.
Hello, Dr. Njoo. This is Mal Hamidi with the Canadian Press. There has been a lot of talk in the recent few weeks on the logistics of distribution of vaccines, especially regarding equipment and transportation and so on. But we haven't heard a lot about the medical staff that is going to administer the vaccine actually in northern and remote communities. Now, you mentioned there is going to be some webinars available for those people who are going to administer the vaccine. Are you confident this is going to be enough? Especially like Dr. Sharma said earlier today that people who are going to take the Moderna or the Pfizer vaccine have to stay in the medical facility where they took the vaccine for 20 minutes or 30 minutes to be watched for any allergic reaction. Some of the remote, or actually many remote communities, don't have one doctor in the community. So how are you going to deal with this? Have you discussed this? Do you have any plans to maybe move medical staff to remote communities to help in administering the vaccine?
Thank you very much for the question. I think, first of all, what I would say before even getting to your question is that you're right. It will be a medical healthcare staff that will be administering the vaccine. And I would think that it's a good opportunity for me now to say that, Canadians as a whole, we're not out of the woods yet. All of the good public health measures need to be maintained right now, because I would say healthcare staff are exhausted. They've been at this for so many months since the first wave, and the healthcare systems are getting overloaded. So, they're going to be tired, and now we have this additional sort of obviously maybe a requirement that they would also be administering the vaccine. So we want to really lessen as much as possible the strain on their healthcare system. So I think, even though vaccines are, as you say, the light at the end of the tunnel, it's so important that we support our healthcare workers right now with the actions we do today. With respect to the issue of actually administering the vaccines, obviously that's within the purview of the provinces and territories. I can't get into the details. I'm sure that there's a lot of good people working in the provinces and territories looking at all of the logistical aspects, be it in rural communities, urban communities, certainly from, I think, a federal government perspective and working with our partners. What we aim to do is giving the tools, as I said, with webinars so that the healthcare providers have the information they need. They are trusted sources of information, and certainly as we want to, as you say, boost vaccine confidence among the general Canadian population, it's important that they also feel confident that they have the right information to be able to answer the patient's questions. But in terms of administering the vaccines, I think everyone's excited. I think healthcare workers are also, I think, re-energized to be able to get the vaccine themselves if they're on the front lines, but also to administer to other individuals in a high-risk populations. But please, think of them as you go about, especially with the holidays upon us. What you do now might have an impact on them in terms of what they may see in their emergency rooms in January and February. So we don't want them exhausted so they can't even administer the vaccines in, March, April, and so on. Thank you.
Okay, as a follow-up, I want to turn the same question to Dr. Wong. Have you asked the federal government, the Indigenous Services Canada, have the department asked the government for support in this regard for medical staff through maybe General Fortin or another body in the government?
Yeah, thank you so much, for your question. Indeed, one of the things that, we have been working with all of our partners, First Nation, Métis, and Inuit partners, as well as provinces and territories, in the working group, is to jointly work together about the human resource plan, whether it's medical staff, nursing staff, dental professionals, and trainees, nurses in nursing school or medical school, etc. In addition to that, we're also in dialogue with CRC, the Canadian Red Cross, and also, with General Fortin's, group, the military, about, any type of assistance they can offer. So all of that is part of the plan that's co-developed by the Indigenous people, together with, supported by provinces, territories, and the federal government. Thank you.
I would just add to this that in our conversations about readiness of the different distribution sites, provinces and territories, we know, are looking at non-traditional immunizers. So very much, the dentist, physical therapist, and so on and so forth, to add capacity. So that's part of the discussions. I think that the provinces and territories are sharing some best practices and ideas right now in different tables of discussion. And that's very much being looked at by my colleagues at the agency in Health Canada, as well as Indigenous Services Canada. But we're not there yet. We're not at full capacity yet. As we scale up, there's an ability for provinces, territories to have teams that move to different locations to administer. And that links into a comment that was made by Dr. Njoo prior to this, that we're trying to provide doses in sufficient quantity to bring forward to the remote and isolated areas, the remote communities in the north, maybe once, maybe twice, but go less often and make a difference. Go there and administer in sufficient with sufficient numbers. So that's very much what all of us are looking at right now.
Thank you very much. And that was the last question. On that note, that will be all for today's press conference. I wish everybody a happy holiday and please stay safe. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Sur ce, je vous passe de très belles fêtes et soyez